So nervous systems examination. Firstly, we go to a quick review for the nervous system. So nervous systems, we separate with central nervous systems and peripheral nervous systems. We separate with two parts. Central nervous systems, including the brain and the spinal cord. So we shortly say central nervous systems, CNS, and the peripheral nervous systems, PNS. And both these systems, by their functions, they have sensory, they have motor. Even we put sensory, motor in the PNS part, but they passing the route go to CNS also. So that's part in the PNS, part in the CNS. So sensory little bit simple. They just send the information go into the CNS, go to our brain. But PNS motor part, especially in PNS motor part, so that's a little bit complicated. Because we're talking about they control the movement of the body. They control the body skeletal muscles kind of movement. That kind of control is voluntary control. So voluntary control, that means if you try to walk into some place or if you try to use your hand, you can control it. So that part we call somatic nervous systems. Another part, they control internal organs. When they control internal organs, that's automatically control there. It's not like you think how you control it, or you try to stop it, It's not able to. That's involuntary kind of control. Involuntary kind of control means it automatically working there. So that's control the organ part. And the automatic control also separate two branches. One branch is sympathetic part. Another branch is parasympathetic part. In these two parts, they control for the organs. They help each other and balance each other. So basically for the same organs, they will have two branches there. So that's the basic picture of our nervous systems. Then we're talking about the physical examinations. The technique. So basically, when we're talking about physical examination for nervous systems, we need checking few functions and in different parts. Basically, we separate a few big parts. One big part is the mental status. Like generally people's behavior and people's speech function, language function, and their mood. So that's some general information reflection the mental status. Then we will checking for the cranial nerves. With the cranial nerves, we have 12 pairs. They have different functions and control different parts of the body, but mainly in the head. Certainly, some bunch go to internal organ later. We're talking about later. And then we separate by their functions. We checking for the motor functions and the sensory functions. Motor functions is kind of moving functions, including how strong the muscles can hold in there, including how they can walking way or standing way. Sensory function, basically, people can feel painful sensation, can feel the temperature touching the skin, and also can feel the pulsations and the vibrations. We're talking about some detail later. That's superficial sensation. And the deeper sensory. That's like the pulsation movement. And also we checking for some reflections. Reflection should be belong to combination sensory function and motor function. It's kind of combination together. So we have some special tests go to that area. So that's the general picture with examinations for the nervous systems. Firstly, we're talking about mental status. So this part, basically, when people is coming in, when we're looking for the patients, we got like emitting the idea. This the mental state is normal or abnormal. We can see from patients kind of face or kind of movement, and then behavior. Behavior is normal or abnormal. Then we're talking with the patients and ask patients questions and to hear the patient's answers. So normal people, they can normally communicate with you. But if you have mental disorder, they are not normal community with you. Maybe you ask questions, they answer some questions, but they are not totally answer your question. they may talk about something else. So that's the mental, some abnormal reaction there. And then we see the patient's mood, like pretty crazy or peaceful. And what's the mental thoughts? And what do they feel, the others? Yeah. Some feeling functions. And also some like memories. Sometimes truly we can have some special tests. Like we can give patients some picture and give them some time, about 1 to 2 minutes, and then to see how much they can remember. So that's basically we have some tests, especially can test for the memories, and also some other functions like calculation functions and some focus functions. So that's basically about mental states. So checking for mental states, basically we know some people, they will have, like everybody have calculate function, have answered questions normally, and also they can have memory functions and organize the language functions. So lot of questions we can making for checking for people's mental status. So that's basically for this part. And we are immediately can find some people have some disorder for mental status. So this part basically is a test for all brain functions. So mental function is our brain functions that belong to our central nervous system functions. Then we're talking about checking for cranial nerves. So cranial nerves, so still go to some review for nervous systems. We say our nervous system generally we separate central nervous systems, CNS, and the PNS. So CNS, including the brain and the spinal cord. PNS, including the cranial nerves, that's 12 pairs of the cranial nerves. These 12 pairs of the cranial nerves is kind of a nerve bunch directly coming out from our brain. Bunch out. And then we have 31 pair of spinal nerves. Spinal nerves, they bunch it directly coming out from spinal cord. So that's our picture of nervous system. Now we're talking about this part. Cranial nerves, 12 pairs. These 12 pairs, they have their order. They have their special number. Number 1 to number 12. and they go to their special location and they have their special functions. We're talking about them one by one. The first one go to our nose. So mainly functions for smelling function. So when we test for people's smelling function, we can give patients something to smell, like some liquid, put some alcohol there, or maybe orange juice in there, or vinegar there, and then put close to patient's nose, ask patient if they can smell it, and what inside, inside of the cups. So that normally people will smell it and tell you. So that's mostly we test for smelling functions. And vision, number two. Go to the eyes. Go to the eyes. So basically, when we're talking about checking for the height, we're talking about some special test for the eyes. One, we especially talking about the vision field. We cover like a practitioner and the patient face to face and cover practitioner like cover the right side of the eyes. The patient cover left side of the eyes. Then they face to face and put the finger beside. Then to see, compare practitioner with the patient's visions. If practitioner can see but the patient couldn't see, that means the patient's visions have some degree. So that's when we're talking about checking for the height area. Truly, we have few ways to checking for the eyes. So that's cranial nerves number 2. Number 2. Cranial nerves number 3, number 4, number 6. They are together. Control the muscles around the eyes movement. That's motor part. Motor part. And they also have a bunch for sensory part. Also for the sensory part in the number 3. So basically, these few nerves go to the eyes. We can check for the eyeballs movement. Normally, people can move the eyeballs to all the directions, like 360 degrees there. That's normal movement. We can ask patient looking upward and downward and moving to the side, inside, lateral side. And also they cooperate each other. Still remember when we're checking for the height, we're talking about put up like a pad in front of the nose and more close to the nose. Looking to eyes, they can focus to the pad. Convergence kind of test. So that's normal movement of the eyes. For cranial nerves number 3, 4, 6. Number 5. We're just talking about TMG joints. TMG joints. TMG joints. In front of TMG joints, the cranial nerve is number 5, passing through from there. So they have functions mainly for sensory function. Face, on the face, sensory function, and the jaw. We're talking about they have 3 branches. Upper branches go to around the eyes. Middle branches go to around the nose and the upper part of the mouth. Lower branches go to the jaw. And truly, their branches go to the eyes, corneal reflections. That's the motor part. That's the motor part. So cranial nerves look like they will combination with sensory function and motor functions. And number 7, 8 functions mainly for the face movement. Like people eating, they use the muscles on the face. People speak, still use muscles on the face. So that's controlled by the number 7. Number 8, go to or inside of ear. Mainly function relationship, hearing functions. Number 9 and number 10, you can see some combination here. They control the swallowing functions, rest patella, that's inside the mouth. So that's relationship with people eating. And some combination, we're talking about number 5 already. Number 7, we're talking about already. 8 combination with number 10 and number 12. Relationship with people voice and speech. Like we say, number 7 is facial movement. When they speech, certainly the muscle will be movement in there. And number 11, basically for the shoulders and the neck movement. Number 12, basically control the tongue. So here we mainly mention the function in the head area. Truly, we have a nerve branch go down to the chest area. Basically number 10. You see we have picture here. You can see the picture here. You can see the picture number 10 here. They are not only working in the head area. They also go down, control internal organs. So like the motor part, go to the heart, lung, and the bronchi, and the stomach tract, digestion tract, and also sensory part, go to internal organ also. So that's they are not the other nervous branch mainly control on the head area. And in this picture, the central part, that's the brain here. That's big brain here. That's the brain stem and connected with lower part is the spinal cord. So that's the breathing. And then you can see the cranial nerves coming from which part of the brain, or maybe the breathing, and then go to control different areas. So that's basically still belong to your anatomy class. We just go to some review here. So that's we talking about some functions. Then we see some examinations, and especially for the cranial nerves. We talking about some already, like smelling functions, eyes movement functions. Then we talking about another one here. Test the cranial reflex. What means cranial reflex? So put something on the superficial of the eyeball, that's basically corneal area, and then patient immediately flashing the eyes. So that's the normal reaction of the cornea. Certainly, if patients have some disorders, they may losing these kind of functions. So that's another special test for the eyes area. Then we go to spinal nerves. So spinal nerves go to other part of the body, and they have the functions. We're still talking about they have both motor function and sensory function. So we separate talking about the motor function first. Then we talking about the sensory function. And finally we talking about reflection. We say reflection is the combination sensory and motor function. So we have some tests there. Let's talk about one by one. Let's talk about the motor function first. Motor function means the muscles movement. So basically we're talking about the skeletal muscles here. They maintenance its movement. Firstly, they have some strength. Like even they are not movement, they still keep the tension there. Like how stronger of the muscles, they normally can hold in there. And then they can maintain normally movement. And in the motor function part, we also can be some trouble. So these two belong to the normally motor function part. But in some sick or abnormal condition, patient may have some movement. They couldn't control it. So that's for sick or ill or abnormal kind of condition, involuntary kind of movement. So people will have normal this kind of holding or movement in there. But if these kind of three conditions happens, that's abnormal condition. Then we're talking about what means normal, what means abnormal. So this picture shows us we test patients like normally they have stress in there. We test for the patients. We holding the patients, like with this hand, and then binding the patients with our other hands, and ask the patient to against us, against the practitioner. So we do flexion kind of movement, and then patient holding there. And we do extension movement, patient still holding there. So that's basically people will have normally some degree kind of against it. If you just try to moving that way, and pretty easily, you can move patient's arm that way. And if you moving this way, pretty easily, patient moving this way. That means patients like they losing some control. Their skeletal muscles control here. So that's basically we test still the nervous sponge coming from neck area go to control the upper arm and the hand. So that's the way we test. Way to test. So here we are not talking about muscles trouble. We know muscles is controlled by the nerves. So basically, patient losing nervous control, and then like they losing muscles tense there. And the same idea here. Tell the patient holding our fingers tightly, and then we try to remove our fingers from patient's face. If patient can holding there, means they are normal, they are function normal there. If patient couldn't hold it, you are pretty easily to remove your fingers. That means some abnormal. So still the nerve branch coming from C7, C8, and maybe T1 area, they control their fingers here. So that's another test. Then we specially test for finger movement. So like a patient adoption, that means adoption, their fingers. Then we try to moving, go to inside to see if pretty easily, that's abnormal. If not that easy, that's normal. If too easily, that means C8, T1 have some disorder because nerve branch control the fingers C8 and T1. I guess we have picture later. Let's see. Okay, this picture. So basically what we're talking about here, we're talking about the spinal nerves control different parts of the body. So you can see here, C8, T1 control the small finger part, and the C6, 7, 8 control the thumb and the index finger part. And the middle side of the arm control C8, T1. And the lateral side of the arm controls C5, C6. So thus we test for different parts of the arm and their functions. We know if they have nervous bunch, have disorder there. So that's basically why we talk about different area we test. We know that some disorder happens in which levels. So that's for the fingers. And another test for the fingers. So put our fingers and the patient's fingers and try like the patient, the thumb touching the small fingers here, against the resistance. So that's basically some test for the arm part, for the arm. So any kind of test here, patient can against you. That's grade 5. That's grade 5. So that's also go to the leg, go to the hip. If patient can against you, that's the normal condition. We can test for different parts. Certainly, the relationship with different nerves, like spinal nerves, coming from different levels. But if they can against you, that's grade 5. That's a normal condition. If they couldn't against you, that's we separate with different levels here. So grade 0, nothing happens. Grade 1 is little bit reaction here, but still pretty weaker. And grade 2 better than grade 1, still not normal. Still not normal. And grade 3, grade 4 is clear explanations in the radio. Grade 4 is close to the normal. It's little bit against gravity and some resistance. But grade 5 is the normal condition. Grade 5 is the normal condition. So that's basically we do some tests to test for muscles response. But what controlled muscles is the nervous controlled muscles. So basically the patient have disorder look like in the muscles, but it's not muscle itself. It's the nervous have some trouble. Then they couldn't move. Muscle try to move it. Must be have nervous system. Normal control them. So that's basically for the motor functions and we test to see if we have any question in this part. The pretty similar. So that this one holding the hand over the knee and try to bending patient's leg and ask patient resistance, against your resistance, go to other side. So that's for the knee, that's basically test level L4, L5, S1, S2. And another one here. So still similar, bending the knee, For extension, last one is flexion, this one is extension. So extension, ask patient against you. Patient against you, go to extension directions. That's basically examinations for L2, L3, L4 levels. So different tests, we test for different levels. And this one for hip joints. Put a hand, look like for the knee area, but basically ask patient lifting for whole leg here, whole leg flexion. So that's we test for L2, L3, L4. So that's we finish the motor part. Finish motor part. Basically, motor part, we're looking for the muscles, like how they are able to move their muscles, how stronger of the muscles. 5 is normal. Yeah, remember, 5 is normal. Less than 5, they have different degree. 0 is totally losing contraction functions. So that's the motor part of the muscles reaction. Then we go to the sensory part. So we're still in the nervous system examinations. So nervous system examinations, we go to cranial nerve first. We have 12 pairs of cranial nerves. We have different ways to check it. Then we go to spinal nerves. Spinal nerves, we have 31 pairs. They control different parts of the body. And functionally, they have movement function. That belong to motor part. So we just finished motor part. Then they have sensory functions. They still control different parts of the body, but just the feelings functions. In sensory part, sensory functions, we still separate with 2 parts here. One part is superficial sensory. Like people can feel the pencil, can feel the touching, can feel the temperature changing. That's superficial sensory. And also we have deeper sensory. So deeper sensory part usually we use sensibility. So sensibility means we can feel some movement. We can feel the pulsations and we can feel the vibrations. So that's the sensory functions of the body. So we say nerves control all of the bodies, including the motor, including the sensory. Basically, they control in the same levels, the same nerve branch. They will come in with sensory and motor. So that's on the face part. Basically we talking about already. That's number 5. Trigeminal nervous. Cranial nervous number 5. So that's basically mainly we talking about the 3 branches. 3 branches. Go to around the eyes, go to around the nose, go to the jaw area. And they have another small branches. Usually we are not talking about that small branches. It's so like small bunches there, and we don't have too much like that strong kind of feeling on the face. So we usually just talk about 3. Even the name, we only name it 3. And then we have cranial nerves, number 7. Facial nerves. Facial nerves, mainly, you can see basically still on the same area, still on the face, but mainly is the motor function. So that's on the head area we finished already. And on the body part, so spinal nerves, we say we have 31 pairs, but we are not directly calculated from 1 to 33. We separate a few areas. In the neck area, we have 8. Chest area, thoracic area, we have 12. Lumbar area, we have 5. And the sacral area, basically we still have 5. And under sacral area, we have 1. So that's basically. So from this picture, you can see they control different level of the body. They use different color here and a number here. So if we find special area, especially for sensory, like chest area, we are not that easily test for the motor functions. But truly we can test for sensory functions. So if patient has special area, they losing the sensory, means especially that nervous bunch have some disorder. Certainly, when we're checking for motor function, we can go to the arm and the leg. But sensory, we still can go to arm and the leg, and also on the body part. So that's different area they control by the different nervous bunch there. So basically sensory, when we touch it, when we examination or checking it, we can just like a sensory, superficial sensory. Usually we can go to like a body part. We can use a small needles to touch in there and ask a patient if they feel it or not feel it. And the deeper sensory, like a movement sensory, position sensory, usually we go to the arm or leg, like bending the patient's fingers, tell the patient close the eyes, and then we bending patient's fingers, and then ask patient, the finger moving up or moving down, or maybe the toes, maybe the toes. So that's when patient close the eyes, you bending patient's fingers, they still can know like you bending which way, So that's basically belong to deep sensibility, precision senses. And also we can use a special tools. That kind of tools we can test for the hearing. Also we can test for the deeper sensibility. Make some vibrations. Make some vibrations with these special kind of tools, and then putting on the patient's body, like the fingers, or maybe the legs. Then ask patient, still close the eyes, certainly if they open the eyes, they can see it. But they close the eyes, they still can feel it. Vibration in some special part of the body. Thus belong to deeper sensibility. So sensory function, let it be easier, And the temperature, temperature. You can put a cup of the warm water or hot water to touching for patient special part of the skin and ask patient is cold or hot. You can prepare 2 cups of water. 1 cup is hot water. 1 cup is cold water. Then touching, still tell patient close the eyes. Then use the different water touching for patient's skin, and then ask is cold or hot. So that's the normal functions. Patient can tell you. If they couldn't identify, that must be have some abnormal. And painful we use needles slightly, or let it be sharper kind of like a wood or whatever. And you can just use fingers slightly touching. Patient can tell you where you're touching. So that's the sensory function part examinations. Then we go to neural reflections. So that's basically combinations with sensory and motor. We have superficial reflections. We have deeper reflections. These 2 reflections belong to normal reflections. Normal. Everybody should be have. If some people don't have, that's abnormal. Then we have pathology reflections. Pathology reflection is abnormal. If patient have these kind of reflections, that means abnormal conditions. So let's go it one by one here. So superficial reflections, abnormal reflection. So basically you can use something touching or scratching superficial of the abdominal area. And then you can see locally muscles contractions. So that's the abdominal reflection. So go to abdominal area. So that's normal. And the second superficial reflections, go to the feet. Feet reflections. So that we have picture here. Go to the feet. So scratching around the side part of the feet, basically from small toe part. You can scratching on the bottom of the feet, or even on the superficial dorsal part of the feet. Go like this way scratching. The normal reactions, all the toes go to this direction. That's normal. But when you're scratching, these 4 toes still go to this direction, but you can see the big toe, they moving upward, like this direction. That's abnormal reaction here. These kind of abnormal reactions, they have a special name. The name is Babinson positive. That's the positive. Certainly, that's the negative. Negative is normal. Positive is abnormal. So that's for these reactions. So that's for the superficial reflections. Superficial reflections. And the deeper reflection. Deeper reflection, we go to different parts of the muscles. Bicep and the tricep on the arm. And then we go to the leg, patella, and the Achilles tendon reflection. So I think I have some picture follow. So that's basically put your hand, specially go to special the tendons there, holding the tendons, and then you use some tools hitting the tendons area. Patient will have a reaction there, like bicep and the tricep and the patella. People sitting there with the knee and hitting the under the knee tendons there. Patient's reactions, leave the knee, go to this side. That's normal reaction. And the same thing for the axillary tendons. Strip the feet like this way, and then we use the tools hitting the tendons here, and the patient will move in their legs. So that's for deep reflections. We say bicep tendons, tricep tendons, patellar tendons, and axillary tendons. So that belong to deep reflections, just relationship with different levels of nervous functions. So all of these tools, superficial reflection and deep reflection, is normal reaction for the people. So basically, normal people, you can find this tool, different kind of reflection. But certainly, you need correctly to hit the tendons there. Then you can see the reflections. And another category here, physiology kind of reflection, means normally we couldn't have these reflections. If they show up, that means some abnormal reactions. Backbone signs we talked about already, that's generally central nervous damage. And we also have another two signs here. One is Kearney signs, one is Bone-Zenke signs. That's both coming from doctor's name. These two signs show up basically infections in the cover of our brain. That's we call meningitis. So that's how we do it here. Tell the patient lay down here And with the knee flexion here, then bending the knee, go to this way, holding the knee on this way. So normally, patient will be over 135 degrees. So like this kind of 135 degree here. So basically, normal people can more than 135 degrees, no pain. If patients less than 135 degrees, then patient feel pain usually on the back area. So that means positive. So that's one reaction here or test here. Another one. Patient lay down there. Then we bending patient's head. Flexion reactions go to abdominal area. And the patient automatically lifting the leg because they still have some painful situation in there. They lifting their leg, try to relieve some pain. So that means positive. Both these two tests happens when patients have inflammations on the cover of our brain. We say cover of the brain, we have 3 covers there. But between these 2 covers, you can see the picture here, they have some space, like a punches there. Between that space, we have fluid circulation, CSF. That kind of fluid, now the circulation around the brain area, you can see basically the circulation also go to the cover of our spinal cord. And then the circulation back. So that kind of circulation. So that means if we have some inflammations in this area, follow that fluid, they will go to around our spinal cord area. So that's all the nervous sponge coming out from the spinal cord. It causes some painful situation in there. So that's like this picture, they cover, pretty similar cover, the brain and the spinal cord. So fluid circulation in there. So that's for these 2 tests. That's for these 2 tests. So if these 2 tests positive, means patient have inflammation happens in the cover of the brain. That's manager. Okay, the first one already. So that's the pathology kind of reflections. I think we're missing some part before for the movement. Okay, so let's go back for the motor function here. We're talking about the muscle stretching and the muscle tense. And we also have some pathology kind of movement. That's involuntary kind of movement. Remember, all of these belong to pathology kind of movement. So pathology kind of movement, the first one, everybody pretty familiar with, trauma. Yeah, trauma. I think you see some people, mostly trauma on their hand. Yeah. kind of trauma. So that's abnormal, involuntary kind of movement. They couldn't control it. Yeah, they couldn't control it. Even sometimes, if they try to control, they got more trauma. Yeah. More stressful, more trauma. That's one kind of abnormal kind of movement. And we have another two abnormal movements. So these two movements still couldn't control. Yeah, people couldn't control. This one look like a little bit faster, one little bit slowly.